I guess this would be for Sanjaya with the scoliosis and even with the current Walk Sense project. What was the most challenging segment that you came across when developing a motion capturing product in Sri Lanka? As their system is not a research setup, but an actual product. And along with that, can you suggest a pragmatic way to use your invention among Sri Lankan patients? So that second part, maybe Mr. Kitnasamy can address. Thank you.
So if I talk about the challenge that we have is actually the one challenge is like finding the required funding to develop such system, and also for like we at the very beginning we tried to find out like full-time people for working for the project, but being a startup and keeping the employees together with the project, it's kind of challenging. But I have no doubt about the talent we have, because the biomedical undergraduates in the university, they're really talented and they're really interested in working such projects. Only thing is like when it comes to innovations, like without kind of huge funding, it's kind of hard to get good. So that's the major challenge that we are having. Yeah, I think I answered the question. And also, I should thank Mr. Gopi from the MJ Foundation, also Sanjaya, like funding and for like supporting to develop the system, and it's actually a real need.
Mr. Gopi, over to you.
Yeah, definitely, Sanjay, and because the local innovations and affordable solutions are the best way to sort of break the barriers in the rehabilitation. Because as clinicians, we face a lot of challenges because of this unaffordable or very expensive products, which like low middle income countries and settings like developing countries in Sri Lanka, which is not affordable. So definitely Center for Biomedical Innovations, like organizations like Center for Biomedical Innovations and people like Dr. Pujita, they're taking this forward, because this is going to be very useful for us, for the clinicians, because we have been doing 2D gait analysis at our centers to analyze gait, because it's a very important thing, particularly for children with cerebral palsy, to say even to prescribe them sort of an orthotics or any sort of step forward in the rehabilitation part. It's very important for us to analyze those, not only the gait, also the motion, but with this partnership and this work we are doing, the foundation, the MJF Charitable Foundation, has been always supportive of local innovation, because that's the best way to answer this actually the needs. So here we are, like we have been working, and as Dr. Pujita said, we had a lot of difficulties during this pandemic because of the delays and particularly the teams getting affected because of the travel restrictions and also other issues. But still, we are taking it forward, and we have been working together. And this is the way. This is the way. There should be more innovations, local innovations, and that's the best way to sort of sort these issues in the rehabilitation area.